Have you heard of split dosing and wondered if it was right for you? We're going to talk about split dosing Zepbound today. My name is Dr. Lindsay Ogle, and I'm a board-certified obesity medicine physician. And lately, either through Lilly Direct or the Medicare Bridge program, which I did a talk about both of those recently that I'll link below, I've been prescribing a lot of Zepbound quick pens, or their multi-dose pens, which look like this. And sometimes for patients, I recommend split dosing. So what is split dosing? I don't know if there is a specific definition of split dosing, but my clinical definition is using a dose that is not the manufacturer's recommended dose, or not the dose that was specifically FDA approved for a condition. And the truth is, this happens all the time in clinical practice. We do individualized dosings for various reasons, for side effect management, based on body weight or response to a medication. Many times we use medications off-label for a non-FDA approved indication. So this is very common clinical practice. But as always, even though I'm a physician, I am not your physician unless you see me at Missouri Metabolic Health. But you should always talk to your doctor about what is best for you and recommended for you. I'm not giving you direct medical advice. I'm just educating about options that are available, that you may take that information and then talk to your own doctor. And then oftentimes split dosing also refers to spacing out the dosing. So splitting the weekly dose into two different doses that you take in the week. And so that could be every Monday and every Friday, you take half of your weekly dose, would be typically how this is done. So there are three groups of patients that I consider split dosing for. One is side effect management. If I have a patient who is very sensitive to GLP-1 medications, then I may recommend starting at a dose that's lower than the 2.5 milligram dose. Or if we're titrating up, we may go between doses. So Zepbound increases by 2.5 milligrams and all the way up to 15 milligrams. And so during those dose titrations, we may, for a period of time, utilize a dose that is in between that next higher dose to help manage and mitigate side effects during the dose titration. And that could be if we are keeping the dose throughout the week, or if we are splitting up the dose and doing two doses in the week. If we're splitting the doses up between the week, that is kind of my second group of patients. This is for people who really notice significant either side effects or significant positive effects. So appetite suppression, craving control, increased satiation or fullness for the first few days after their injection, but then that really dissipates and goes away at the end of the week after their injection. They are likely to benefit from that kind of true split dosing. And it's really important here, we are dividing their current weekly dose into two doses. So for example, if they're at 10 milligrams, we are going to do 5 milligrams, again, maybe on a Monday, and then another 5 milligrams on a Thursday or Friday. Talk to your doctor about what makes most sense for you, but that would be something that I would consider for a patient who had really strong effects on the first couple of days after the injection that go away towards the end of the week. And this is actually fairly common on Zepbound because the half-life of this medication, or the amount of time that it takes for half of the medication to be processed through the body, is about 5 days, and it's recommended to be taken every 7 days. And it's true, as you're taking it regularly, it kind of builds up in your system and you don't notice those swings as much, but everyone is different. And again, some people really notice that difference throughout the week, and the twice a week dosing does wonders for them. And then last, sometimes we do split dosing for cost savings. If you do not have insurance coverage, these medications are very expensive. And so I sometimes prescribe a higher strength of the pen if they're going through Lilly Direct, and advise them to take a lower dose. And you can do that by counting your clicks in the pen. And this is something that I am not getting into the weeds during this conversation, but I'll include a chart here so you can reference what that might look like. But this is so important to talk to your doctor about, because you guys need to be on the same page about how much medication you are actually taking, so they are giving you great advice. So again, if we're doing that 10 milligram pen example, you could be potentially prescribed the 10 milligram pen, but maybe you only need 5 milligrams a week. Then you would, instead of turning the dial all the way to 1, and there's 60 clicks or dashes till that 1 marker, the 1 indicates that is the amount of medication that the pen is prescribed for. So again, that would be 10 milligrams in a 10 milligram pen. But if you only needed 5 per week, you could count to 30 and then give yourself the medication at that time. And that would be your 5 milligram weekly dose. And then instead of only having 4 doses, you would have 8 doses in that pen. And so just to show you, this is a sample. The pen starts at 0, and then you turn the dial all the way until it shows the 1. And that 1 indicates the amount of medication that the pen is dosed for. And then when you were giving your shot, you would give your shot and it goes back to 0. And you have 4 of those in your Zepbound quick pen. But if you use a lesser amount than is prescribed, the pen is going to last longer. Now, a couple of questions I've gotten on a recent video that I made about this. A very common question is, do you prime each dose? Yes, you want to prime each dose. What is priming? Priming is when you start at 0 and you turn to, it's just 2 clicks to that long knob. And then you just press the button and it goes back to 0. All that is doing is it's getting any air bubbles out. And what I'm going to do very soon, once I get some needles to actually show the whole process, although I'm not going to inject myself because I don't take Zepbound personally, I'm going to show the whole process on how to prepare your pen and take your injection. So stay tuned, subscribe so you can have access to that video. But you do want to prime your pen with each dose. Another question is, where do you get the extra needles? So I have included information in the description below, both general information and then a link to Amazon. You can get 100 needles for $20. So should not be a worry. That should not hold you back from using the split dose if cost is a concern and you've talked to your doctor about utilizing that option. Another common question about split dosing is, how often should we refill or order our Zepbound? So if you are utilizing the Lilly Direct, they require you to order your next pen within 45 days from your last purchase. So that is very important to know. If you are outside of that 45-day window, then you will have to pay a higher price. And it's about $699 for the higher price for 7.5 and higher. So this is something that you really want to stay on top of. So even if you have a couple of doses left, you want to order within that 45-day window. And it's okay to keep a little bit extra on hand. That's all right. It's not going to go bad. But if you're having quite a few extra pens, talk to your doctor and maybe you can take a break from ordering for a while. Then the expiration date. So it says on the manufacturer label that you should use it within 30 days. And there is no danger in utilizing the pen longer than that 30-day period. It doesn't go bad or become dangerous to take. theoretically it may become less effective, but my patients have not had that experience, but something to be aware of. Also, there are some people who are worried about the pen not working after the 4th dose. Also not the experience of my patients. It seems that the pens that are provided in the United States at this time do not have that locking mechanism after the 4th dose. There are 4 doses for the prescribed amount. So again, with that 10 milligram pen, it has a total of 40 milligrams in the pen, 4 doses of 10 milligrams, not 4, pushes on the button, if that makes sense. Hopefully it does. And then there's also been some questions about keeping the pen at a certain temperature. When you're utilizing the quick pen, it is best to just take it out, use it, put it back in the refrigerator. But if for any reason your pen stays and gets to room temperature, and that's considered between 46 and 86 degrees, then it should just stay at room temperature and you can continue to use it per regular. The manufacturer says it should only be at room temperature for that 30 days, but because you're paying cash for it and because it seems to maintain its effectiveness beyond that 30-day mark, I would continue to utilize it. You always could potentially call Lilly and see if maybe they would give you a one-time replacement if you wanted to go through that process. I've seen that happen for a few reasons, like the pen overheating or accidentally getting frozen or a malfunction of the pen, but you would call Lilly direct for that. And then if you're utilizing your insurance, I would still fill it every 4 weeks. There's no reason not to utilize that program and fill your medication every 4 weeks. So I hope this gave you some more information about split dosing with Zepbound. Is this something that you're already doing or have considered doing? Do you plan on talking to your doctor about this option? Please let me know. Please share your experience so other people can learn. And I look forward to seeing you next week. Take care.